The center it started out as a clinic for the homeless, mentally ill people in downtown Cincinnati. And the purpose behind it was to provide services to folks that were having difficulty getting services in some of the other agencies or maintaining their ability to stay as a client in some of the other agencies. It was a great idea. It sounded really simple. I knew nothing about starting a clinic, absolutely nothing. I just knew what I thought we needed to provide to the people to help them gain some stability.
Connie came to HRC with a dream. It was a dream. And in some instances, it's still a dream for her.
Connie and I go back a ways. My involvement with the Health Resource Center was at the initial dream stage. Connie and I consulted together at Shriners, and we knew each other at the university. We did some research together, and I heard of a dream.
So I talked with Steve Gibbs, who happened to be the CEO of the Free Store at the time, and he said, "Connie, I have a lovely room up on Liberty." He gave us the room rent-free for 12 years. And we moved up to the Free Store, and that was where we opened the Health Resource Center for the first 12 years of our existence. It was a perfect facility because people would come in there for purposes of needing help, needing food, all kinds of things. Bus fare, help with medical problems. We weren't medically oriented at that time. We were psychiatrically oriented. There were only two of us there, myself and a sister of St. Francis, who was doing her second career as a social work student. So there were the two of us running this clinic.
I was always amazed that we did what we did in that space, because you said when you first saw it that it was a big room. It became a very small room in no time whatsoever.
And gradually people would come in for a cup of coffee and get acquainted. And gradually the Health Resource Center built.
Today we are overflowing with filing cabinets and certainly documents coming out our ears. We have approximately 204 clients that are individual clients, but we usually see about 3,000 visits from those 214 clients in a year.
I first came across the Health Resource Center in the mid to late 90s, and I became director of ICRON, and I was attending meetings at the Hamilton County Mental Health Board. And I remember being a new director, I would sit back and just kind of listen and take in what was happening. And at that time, there were many agencies in the community, and I remember one person that would speak up a lot and raise questions and pose different ideas of how additional funding could be used to help the homeless, to help the severely mentally ill. And at times, this person became pretty fiery in some of those meetings, and I was like, I want to get to know that person. So that's where I first met Connie.
It's interesting when people see us in the same building because we're intermingled with the ICRON staff and the clients, and we see each other's clients very often. Our clients will be provided services with ICRON, and ICRON's clients will come over for other services for us.
One of the main advantages I think that we have in this collaboration with ICRON is more stability than we've had. Randy is exceptionally good in making railroads run.
We've come a long way in these last 5 years of making things run more smoothly and having individuals feel more at home when they come into our building.
But I think we've still maintained the philosophy behind the clinic, which is to allow people to come in and tell us what they need, not have us tell them what they should do. Our focus, besides dealing with clients that are having a great deal of trauma in their lives, is to educate students in a multidisciplinary approach so that they learn how to work with one another. And it's really helpful for them to experience working with people that are severely ill. Plus, we as the senior staff supervise them, so they get to see us work with people that are incredibly impaired at times. And there's no better way for them to learn than to watch what we're doing.
One of the things I think I'm proudest of the Health Resource Center is that we have never advertised for clients. Our name is on the street.
I think we're more skilled. I think the staff knows each other very well. We work very well together. And another aspect of it is it's amazing how people will come in to see one of us and just tell their whole lives to people they've never seen before. That's always an amazing aspect of doing therapy. I feel privileged to be able to be a part of that.
I've seen so many people come in as difficult people who have had difficulty getting their needs met, who after they've been at the Health Resource Center for a period of time aren't difficult people anymore.
We have served hundreds and hundreds of people that would not have been served. I'd have to ask them what it meant to them.
And I fully expect that the Health Resource Center is going to continue. Randy's pledged that he wants to keep HRC alive, and I expect that he's going to help us. I expect to be looking back, and it's still there.